What type of problems do you think process experiential or emotion-focused therapy is best adapted to?
Well, it was developed for depression. So the first work we did was with people who are clients who are clinically depressed, in research that my team and I did at the University of Toledo in the late 1980s. And then Greenberg and Rice went on and developed that and did, and also Gene Watson and Rhonda Goldman did some quite important studies in Toronto in the 1990s, an early part of this century. So this has been developed over time, and depression was really the first thing that we worked on, and that's the thing we have the sort of the best bead on, right? That's the thing. But over the years we've expanded, and in the 1990s I did, and Sandra Pavio and Les Greenberg did research on trauma and adults who have been mistreated as children, and basically post-traumatic stress disorder. And so we extended the therapy to this, which is an anxiety problem, and that led us to develop additional aspects of the therapy and additional ways of working with clients, additional markers and additional kinds of ways of working. So we developed that. And then now we're interested in social anxiety, and we're developing the therapy further for that. Greenberg and his team are looking at generalized anxiety difficulties, which is another kind of anxiety problem. They're also beginning to look at eating disorders. And basically, the more we develop the therapy with different client populations, the more we learn about it and the better we get, and the more clear we see how far it can be extended. So for example, if we were to bring in pre-therapy into the process experiential model, then we would have a way of working with people in psychotic process. And that's what the process experiential emotion-focused therapy approach has done, is it's basically integrated bits from the humanistic therapies in a very systematic, careful, organized way, figured out when they're most applicable, and studied these processes to make sure that we were being most effective with our clients from moment to moment. So it's gradually been extended. We also have applied it with clients with what we call borderline processes, which is commonly called borderline personality disorder. So we have adaptations for that. But basically, I think, the sky's the limit, right? I'm going to draw the line with working with antisocial folks, people who have antisocial processes. However, it has been used in prisons with domestic violence offenders. Empty chair work, two-chair work, various things. And it appears to be effective with that population also.
When it comes to person-centered counselling as a whole, what do you think would be the qualities that would make someone a good person-centered counsellor?
Well, I think you have to be really interested in other people's worlds, other people's experiences. That was certainly true for me. From when I was a child, that was always really important to me, to be able to come into the world of the other person, to know the other. The first other that I wanted to know was my father, and who was rather silent and withdrawn. And then I wanted to be a writer, and I was always interested in characterization. And so for me, there's a real joy in trying to know the other. And I find once I'm inside the world of the other that I care for them also. That even when they're full of self-loathing themselves, I feel compassion for them. So I think certainly curiosity and the ability to empathically enter the other's world, and a real caring about other people. And also it's really important to be able to be aware of your own process, your own experiences, and to know when they're interfering, when they're coming up, and to not be afraid of your own emotions. Those are some of the important things. I think, for myself, was also important for me to let go of being clever and being an expert, right? So when I stopped early in my development as a therapist, I practiced in a rather eclectic, broad manner in which I was trained psychodynamic, I have CBT training, I have person-centered experiential training, and I was sort of doing them all. And I loved being clever in terms of being able to offer really clever interpretation to my clients or come up with a clever course of action or something like that. And I had to wean myself away from being clever. I think when I was growing up, my mother always commented on how clever I was, and there was a lot of payoff for me and my family being clever. So I weaned myself off of that. And I did it by, I went to Laura Rice, who was trained by Carl Rogers, and I basically said, Laura, I love to interpret my clients, and I no longer think that's appropriate or useful. And what do you suggest? And she says, well, and she, as I said, she's an old-time classical person-centered person. And she said, well, what I do is I tell myself that however clever my interpretation is, what my client will come up with will always be more subtle and richer and more interesting than, and that's what I know now, is that the problem with interpretation is that it's usually way too simple to capture the person's life. And if I can help my client come up with their own self-understanding, it's theirs, and it's got this sort of rich idiosyncratic quality, and I learn something, enriches me as a human being, enlarges me. So those are some of the, some being able to let go of being an expert and being clever is the other thing I think is really important.
Okay, I know you're quite an expert on emotions. I saw you had a diagram earlier on that seemed to go quite into detail. Can you tell us a bit about that?
Well, this is, the sort of core of the emotion-focused therapy approach is the idea of emotion schemes. And that's a piece of jargon, but basically all therapies have some kind of idea about stuff that clients carry with them in a kind of habitual way. In psychodynamic therapy, it's called transference or relational patterns. In CBT, it's called cognitive schemas. We call them emotion schemes. We do that because we want to capture the way in which it's active. A scheme is both a noun and a verb. And emotion schemes are made up of different kinds of experiences. So when we talk about emotion, we're not just talking about sort of bare, simple, like I'm angry or I'm sad. We're actually talking about something much more complicated than that, much richer. We're talking about something which is based in the body, so it's not just I'm afraid, but where in my body am I feeling the fear? Is it the butterflies in my stomach? Is it a tightness in my chest? So there's a bodily component to it. But there's also a perceptual component. It's about something. Emotions are about something. So if I'm scared, what am I scared of? If I'm sad, what am I sad about? And emotions tell us something about our situation. So if I'm sad, it tells me I've lost something, or I'm in danger of losing something. If I'm scared, it tells me there's danger there. If I'm angry, it tells me there's violation. So emotions have information about our situation, so they're perceptual. Also, of course, emotions get processed cognitively. So they're also represented and symbolized. So if I'm scared, I might be saying, what if I say something stupid? Or what if I get attacked, right? But I'm also saying, I'm a stupid person, or I'm a weak person. So I have I create a kind of concept of self, and that's in my head. That's cognitive, conceptual, verbal. But emotions also point to action. The word emotion means what moves us. Motion is in emotion, right? And emotions prepare us to take action. So with sadness prepares us to seek comfort and support from other people. Anger motivates us to make boundaries, to prevent violation, to hold our ground. Fear tells us to freeze or hide or run away. So emotions are action tendencies, right? And so emotion brings all these things together, the cognitive, the bodily, the perceptual, the behavioral, brings them all and integrates it. It's actually what integrates all basically the self, what it means to be human. And so that's what the emotion scheme model is trying to say, is all these things are interconnected. Emotions live in this network or web of connections and different kinds of experiences. And that's the basis of the therapy.